How's it going, guys? We passed a little question on endocrinology, steps 1 and 2. You have an 8-year-old girl who's got diabetic ketoacidosis, and we're handing you the diagnosis here. We're not trying to obfuscate that, increased thirst urination, visual blurring, glucose moves into the lens of the eye, aldose reductase converts it to sorbitol, which has a high osmotic pull, causes swelling of the lens, and upper respiratory tract viral illness can be a precipitating, buzzy risk factor for type 1 diabetes, mellitus inception. So what's most likely to be seen in this patient? And it's past level, as I said, so I made prior clips on this. So all these arrows, OMG, what are we going to do? So it's a metabolic acidosis, high anion gap. It's part of mud piles. And with metabolic acidosis, you have a down arrow for bicarbonate. So we've already eliminated half our answers. We're only looking at these bottom answers here in blue. Okay, we have a down arrow bicarb. That's what we want for metabolic acidosis. Okay, well, what's our next step? Well, we got our CO2, so is that going to be up or down? Well, CO2 is acidic, and we want to blow it off to compensate. Question doesn't have to mention overt cuspal breathing or high respiratory rate or anything like that, but we know that with a primary metabolic acidosis, blowing off CO2, so bicarb and CO2 are both down arrows. Pass level, easy stuff so far, okay? Now, serum potassium is going to be up or down? It's going to be up. So we're going to have hyperkalemia. And there's two reasons why we have high serum potassium in DK. The first reason is we're deficient in insulin. Insulin normally pushes potassium into cells. So if we can't do that, potassium goes up in the blood. That makes sense, right? So obviously insulin is going to upregulate GLUT4 to the cell surface. Glucose moves in. We get increased ATP production. Increased ATP means sodium, potassium, ATPase pump activation of the cell surface. 3 sodium out for 2 potassium in. Well, we just said we can't get those potassium in, so the potassium is built up in the blood. Second reason is going to be something called cellular shift. And USMLE might write the answer choice literally as just cellular shift, which just means as we're making H plus protons, ketoacidosis, the cells are going to be buffering those protons, kicking out some potassium to balance charge. So those are the two reasons why potassium is high in the blood. We have hyperkalemia. We have a down arrow for total body potassium, which of course I don't have here. You just need to know that that high potassium, when it makes its way to the kidney is going to sense that. It's going to increase micturition of potassium. We call that kaliuresis. So we're losing potassium through the kidney, but the mechanisms that started the hyperkalemia are still constant. So we have what's called hyperkalemia despite low total body potassium. Okay, so you gotta know that down arrow for total body potassium as well. And then serum sodium is the difficult one, and it's going to be a down arrow for serum sodium. This is our correct answer here. And the reason is just dilutional hyponatremia of high glucose in the blood. It's high solutes, and it's going to keep water there, and it's going to dilute out our sodium. Dilutional hyponatremia in diabetes mellitus. You say, well, if you got this dilutional effect occurring, why wouldn't potassium be low? Why would it be high? As I just fucking said, those two mechanisms for why potassium is high in the blood. Okay, so this is the difficult variable per se, the serum sodium, that it's a down arrow. Okay, so a recapitulation, down arrow, bicarbonate, metabolic acidosis with an up arrow for anion gap. CO2 we blow off to compensate. Serum potassium's high. Cellular shift, insulin can't kick into cells because you don't have insulin. And low total body potassium, kidneys getting rid of it. So we have low intracellular potassium. And then we have decreased serum sodium because of dilutional hyponatremia. You know the deal. I'm going to make more content like the channel. Appreciate your time. That's it.